In this video, anatomy of right ventricle will be discussed. Right ventricle is the most anterior part of the heart, as it is located just behind the sternum. When right ventricle is viewed from front, it is triangular in shape, whereas the left ventricle is conical in shape. In cross section, the right ventricle is crescent shaped, whereas the left ventricle is circular in shape. Right ventricle extends from tricuspid valve to the apex and cephalad to the pulmonary valve. The right ventricle is divided into three parts: inlet, apical, trabecular, and outlet. This is called tripartite structure of the right ventricle. In some congenital anomalies, one or two parts are absent. Then the right ventricle may be bipartite or unipartite in configuration. The inlet portion of right ventricle extends from tricuspid valve to the insertion of the papillary muscles. That is, inlet portion of the right ventricle contains the tricuspid valve. Tricuspid valve has three leaflets: septal, anterior, and posterior leaflets. Chordae tendineae of septal leaflets directly attaches to the ventricular septum. Anterior leaflet is the largest leaflet of the tricuspid valve. It is supported by a large anterior papillary muscle, which arises from the anterior wall of the right ventricle. The anterior papillary muscle fuses with the moderator band. The moderator band connects the base of the anterior papillary muscle, that is, the anterior or free wall of right ventricle, to the ventricular septum. The third leaflet is called posterior leaflet. It is supported by many small papillary muscles arising from the inferior wall of the right ventricle. There is another papillary muscle called the medial papillary muscle or the muscle of Lanzasi. It arises from the ventricular septum. Specifically, it arises from the posterior limb of the trabecular septomarginalis. The medial papillary muscle supports the commissure between the septal and the anterior leaflets. Apical trabecular portion of the right ventricle has coarse trabeculations. In contrast to the left ventricle, in left ventricle, the trabeculations are fine and shows a crisscross pattern. The outlet portion of the right ventricle is smooth. It consists of infundibular or conal septum. Conal septum on the right side has parietal extension into the free wall of the right ventricle. This parietal extension and the conal septum together are called ventriculo-infundibular fold. The ventriculo-infundibular fold separates the tricuspid valve and the pulmonary valve. The left of the conal septum fuses with the anterior limb of the trabecular septomarginalis. Thus, ventricular infundibular fold sits within the two limbs of the trabecular septomarginalis. The ventricular infundibular fold forms the supraventricular crest at its septal margin, where it inserts between the anterior and the posterior limbs of the trabecular septomarginalis. The free wall of the right ventricle completes the muscular tube known as the subpulmonary infundibulum that leads to the pulmonary valve. On the septal surface of the right ventricle, there is prominent muscle band called trabecular septomarginalis. It is also called septal band. It is Y-shaped band that hugs the ventriculoinfundibular fold between its two arms. The two arms are anterior or superior arm and the posterior or inferior arm. The posterior arm runs towards the membranous septum towards the right ventricular inlet. The medial papillary muscle inserts to the posterior or the inferior arm of the trabecular septomarginalis. The insertion of the medial papillary muscle is a landmark for the right bundle branch. From there, it descends like a cord in the subendocardium of the septomarginal trabeculation. The other arm, that is the anterior or superior arm, joins with the subpulmonary infundibulum towards the pulmonary vein. Another prominent band, the right ventricle, is moderator band. It arises from the body of the trabecular septomarginalis. It connects to the free wall of the right ventricle near the base of the anterior papillary muscle. The moderator band is important because it carries part of the right bundle branch of the AV bundle of the conduction system to the anterior papillary muscle. This shortcut route across the chamber of the right ventricle ensures equal conduction time in the right and left ventricles. How to differentiate the right ventricle from left ventricle? Right ventricle is triangular in shape, where left is conical. Right is crescent shaped in cross section. Left is circular in left ventricle. Right ventricle has coarse apical trabeculation. Left ventricle has fine trabeculations. Tricuspid annulus is closer to the ventricular apex, where mitral annulus is higher than the tricuspid annular level. Papillary muscles arises from the ventricular septum, that is septophilic in case of right ventricle, and no papillary muscle arises from the septum in the left ventricle, that is, it is septophobic. Hope this video was useful. See you soon in the next video.